Hello, hello, hello. This is Tamika Peters, President and CEO of Grow Your Nonprofit, where we help startups, small and stagnant nonprofits grow through fundraising strategies, strategic planning, and so much more. Guys, today you're in for a treat. I have my special guest here, Miss Pauline. We'll talk about the importance of health insurance. But before we get started, I like to thank the sponsors of my podcast. Trinity Life Foundation Naples, helping at-risk youth through their enrichment program. Vaxtruth. They received a grant from the CDC to raise awareness of COVID-19 and vaccine resources in the Black and Brown communities. AVID. That stands for the Associations of Haitians Living Abroad. They just opened an amazing support center right here in the beautiful Fort Myers, where they will help you with immigration support, utility billing, and English as a second language. Last but not least, Best Insurance USA, your local agency provider through Florida Blue. They will help you with all your family health care, insurance, business, and so much more. So, like I said, my special guest here, Pauline. How are you doing, Pauline?
I'm well. How are you, Tamika?
Oh, I'm doing fantastic. It is such an honor to be here with you. I know we probably recorded a podcast last year where we talked about one of your foundations, which is AVID.
Yes.
So AVID is a really great organization that's actually having an event in partnership with Best Insurance coming up.
Yes.
Yes, you're having a 3-day event. Can you share with our audience a little bit about your events before we get into our conversation about health insurance?
All right, Tamika. So the event that AVID gonna have, it's gonna be 3 days Thanksgiving bash. So on the 17th, we're gonna be in the Fort Myers, the 18th, Naples area, and on the 19th, in Immokalee. So we do that every year. So the day that we give back to the community, turkey giveaways, food. So people coming in, that's a way for us to say thank you to the community, and thank God we were able to get partnership with Best Insurance, which is local agency for Florida Blue itself, and also Sante Plus Medical Center. All these companies come together in Midwest Food Bank. So come together to see how do they say thank you to the community. And now we expect that people will be coming in, and all the information will be available to our website, avidahved.org. That's where people will be able to find those locations and the timing of all the events.
Now, a little birdie told me that you're giving away 1,000 turkeys. Is that right?
It is right.
That is amazing.
It is.
So you're meaning to tell me this holiday season, 1,000 families will benefit from a turkey on their plate on Thanksgiving Day?
Yes, we will. That's what we'll do. 1,000 turkeys, not including the foods, all of the giveaways that we're going to have, the kids play, all these things that we're going to have. We do that every year for the past, I could say 15 years.
Wow.
We always give away turkeys on these days, and people love it.
That's awesome. That's awesome.
As I always say, that you don't have a business without your customers. So
you have nothing.
You have nothing without your customers. What a best way to say thank you, especially on Thanksgiving Day.
You're absolutely correct, because, I thought when I walked away from corporate America, I would no longer have a boss, but I quickly realized that my clients are actually my boss.
They are.
Because if they're not happy, they're not going to patronize you, and you're going to be out of business real quick. So that's very important. I believe businesses should always have a philanthropic arm to their business, and I see you do that well. I always admire you because you do so much in the community through your foundation, AVID, as well as Best Insurance. So with that said, why did you start Best Insurance USA? Was there a need that was not being met in the community?
Exactly. So I always call myself a social entrepreneur. I have to be able to serve people in whatever business that I do. But Best Insurance, at the beginning, I was an accountant. I do taxes. I help a lot of people with their business planning and stuff. And when it's come to opening the Affordable Care Act, and I realized that they will kind of merge together. They will kind of get in each other, because the money that the government give you for your insurance, actually, it's a credit from your taxes. They call it advance premium tax credit. So you claim that ahead of time before you do your, almost a year, not almost, a year before you do your taxes. So you get that money so you can buy your insurance. So as an accountant, I realized that will actually benefit my customers if I go into the insurance and help them with that process. So when they come to do their taxes, nobody will mess it up, because it's actually a credit that you claim before. People probably don't see that, but it's a credit that you claim before you do your taxes. And personally, for me, insurance gives me so much great joy, because I've been self-employed almost all my life. So having insurance was a struggle.
Yes.
When I had my kids at a young age, married very early, but they denied me insurance right after my first baby.
Why?
Because I had a C-section. Because of the C-section, my insurance come from $288 to $1,200.
Wow.
Because they said now I have pre-existing condition, even if it's the same insurance company. So when the Affordable Care Act come, so I saw the law, even pre-law, it was a proposal. I'm like, God, that's what we need. We need that.
Yes.
We need that so people like me can be insured, because since then, my first child, I was never able to have insurance anymore, because it was too expensive everywhere you go with pre-existing condition. And second, my kid at 4 years old almost died in the hospital. They refused to even give him a shot because we were not insured.
Wow.
So for me, helping people having insurance is personal, because if it happened to me, my child could have died at the hospital because we were not insured. So how many other people that would happen? I was lucky.
Yes.
The doctor said my son was lucky. He was lucky when I brought him back on Monday to the doctor. The doctor said he was lucky to make it.
Wow.
So I want to make sure I made it my mission, not only to talk about health insurance, how important it is, and to make sure everybody have insurance and they stay with their insurance, because the consequences are too high.
You know, that's very important, because I know all my life I've had positions where I worked in government, where I had insurance, I had a pension, and then when I was recruited to the nonprofit world, that was the first time I didn't have health insurance. But I took the risk because for me, it was a great career move. So I said, oh well, I'm making enough money where I can just go buy health insurance. This was before the Obamacare Act. And it was just my son and I at the time, and it was very expensive. I think it was like $1,200 a month.
Yes.
So it was not affordable to me, even though I made good money. So the way, I guess I fixed it, if you will, I bought a lot of supplemental insurance for like hospital, emergency and critical. I brought all of that supplemental. So I said, well, something happened, then at least we have something. But the entire time I prayed that we never got sick, because I always pay for our because we're healthy. We did our once a year annual physical, what I just paid out of the pocket. But one accident, we could have been bankrupt.
Yes.
One accident.
Indeed.
So that's very important. So the Affordable Care Act through Obamacare really changed a lot of people's lives.
It did. And I every time I see it, I'm like, I wish people could understand how it can change your life.
Yes.
And then people from the minority communities, most of them lose the credit to medical bills. Most people lose their credit to medical bills.
Yes.
Because they go to the hospital, they think if they go to the hospital, they will see them, but they don't know the fallback is you got to pay back. When you don't pay back, they send that to credit collection, and that would hurt your credit. So having health insurance is extremely important, just not only for your well-being, but for your financial stability.
So if someone wanted to reach out to you and learn more information, because I was checking your website, you can people can actually reach out to Pauline and her staff for a consultation and a quote.
Exactly.
So how would they do that? Okay. I call up, I'm interested, I'm uninsured, I'm an entrepreneur, I just started, I don't have health insurance. Walk me through that process.
The best way to do that, Tamika, sincerely, it's really one-on-one. You come to the office, you sit down with the person, you ask the question. Insurance is very complex. Unfortunately, a lot of people, because they can use the internet, because most of the insurance is part of the marketplace, you can go online and you buy insurance. Big mistake. Because what are you buying?
You don't know what you're buying.
Exactly. What does it cover? What do you mean when they say you have copay, you have deductible, this is the network? How do you know if that network is great for you? So that's why insurance agents, they go to school, they license, and not only that, they have very heavy training from the carriers that tell them about those plans, because they have multiple plans out there that can be very confusing for someone. So I can have a bonds plan with that has high deductible.
Yes.
I can see my doctor. I can go check my blood work, do everything like I didn't have a deductible. And someone else have the same, another bonds plan, unless they spend $8,000, they have zero coverage. So they're not going to pay for the service ahead of time for them. So if you go online, you just buy the cheapest one, and at the end of the day, it might not be the correct plan for you. So what we do to answer your question, Tamika, the person will call, if the person call, and agent will talk to them, say, hey, what is, if you can pay it on your own, you're not looking for government help, then we just quote you with your family, your date of birth, and information where you live. So we tell you this is how much it's going to be. We have different plans. They have HMO plans. They have PPO plans. It's going to based on your needs. Then you can choose. But if you come to the office, you will sit down with someone one-on-one, and then they'll go over with you the basic information. If you need help from the government, the first thing to do is to apply for the subsidy. People don't know that it is two-step when you're buying insurance through the marketplace. It is two-step process. First, you apply, give all your information to the government, you give your financials, and they tell you how much money you qualified. Once you know how much money you qualified, this is when you now go search for insurance, and then they will take your subsidy, pay for it. Most people, the good news, most people are more than 50% qualified to get it at zero cost.
Wow.
Yes.
Yeah.
The government cover almost everything, all the premium.
And what I like about your company is that you actually educate your clients, not just we want to sell a policy. And I say that because I have first had an experience. One of your staff members signed me up at the time. I actually had someone sign me up for a plan, and I had a very high deductible. I thought I was covered, but one of your staff members took a second look at what I had, and they was like, "Oh no, you have a high deductible. This is all wrong." And he went on the marketplace and then really found me a great plan that covered my son and I. And guess what? $0. It costs us $0 to have.
Yeah, exactly. That's why the knowledge is power. I dedicate myself to educate the community. I go everywhere that I can, through the radio, to churches, community event, to explain to people not only why health insurance is important and how to buy health insurance.
Yes.
It's not something that you should go ahead and do it yourself. Do it yourself. You have to have knowledge on insurance. If you don't have knowledge, you take a risk. And at the end of the day, the insurance company wins. Because you have a plan that is not going to cover the basic thing that you need. Like you say, a regular physical for the year, your blood work alone will cost you between $3,000 to $4,000 if you want to do a full checkup.
Wow. Wow.
Just a very basic visit. And if you're a woman, you gotta go see your gynecologist.
Yes.
And there are things that if you're in your 40s, then you need your mammogram. Yeah. There are so many other things that will come in, and that the cost will add up just preventing care.
Yes.
Not even you getting sick, just preventing care. So to do preventive care only, it will be costing you so much money. So the best thing is you find an agent, you sit down. Us as Best Insurance, we educate. We tell you, and you don't have to even explain. The good thing, you don't even have to explain your medical needs or what your health situation is. You can say, I need a great plan. I need a plan that will allow me to go to my hospital close to me. I need a plan that will cover those medications for me. And then what pharmacies in the network, you need those information ahead of time.
And your staff could help.
We do that. Yes. Okay. Even your medication. Some people don't understand. You might have a plan. He covers certain plans cover this medication, and other plans don't. So because your friends have a plan, all the medication covered, that doesn't mean yours going to cover.
So it's not a one size fit all.
No. That's what a lot of people think, and that's why they get it wrong. It's not one plan fit it all. No, you want to know your plan and what does it cover. You can have a plan, Tamika. You can only use it at certain pharmacy. And I have a plan that can be used with every pharmacy. In town. So if I have an HMO plan, if I have a PPO plan, that all make the difference.
Right.
So people need to understand and know how to buy health insurance and allow health agent to help.
Right. I'm happy you mentioned that because that was my next question. What is the difference between an HMO and a PPO?
HMO, it's if you take the acronym, it's Health Maintenance Organization. It is really a plan that is there, very good plan. They both cover the same thing, PPO and HMO. The difference is the freedom of the network, of doctors.
Okay.
So HMO required it very, sometimes you have narrow network. When it comes to your PCP, and requires you, some HMO requires you to choose a PCP. If you don't choose, primary care provider.
Okay.
If you don't choose one, the carrier choose one for you. And you can only go to see that PCP. You cannot just wake up and say, oh my God, I have a doctor by my house. It seems like it's always busy. My neighbor say he loves him. I'm going to go to him. No. If he's not in your network, even if he is in your network, if he's not the PCP assigned to you, you can see the doctor.
Oh.
But the great news, you can always call the insurance carrier, say, hey, I see that doctor is in my network. Can I change? You can always switch and change. So the HMO plan, the Health Maintenance Organization, if you are someone who's looking for great care, most of them actually, they aims to preventive care. They really focus on taking care of you, make sure you don't get sick. So that's probably a good plan that is there because the doctors are obligated to take care of you, to make sure you do certain tests every year. But if you're on a PPO plan, not really. Most of it are fee for service. You go, you don't go to the doctor, don't really have to do much for you. You go see the doctor and done. But HMO plan, they are most likely preventive. The doctor have to take care of you. But it can be annoying because of the referrals, authorization.
Oh, I see.
Every time that you have to see a specialist, your primary care need to approve it. Some people can feel like it's a burden. I need to see my doctor now. Some people don't have patience. They want to see the specialist now. But when you're on an HMO plan, it kind of help you too. You just don't want to go see, you might go see the wrong specialist. But the PCP, once they see what's wrong with you, they will guide you to the right specialist. A PPO plan, you don't really need that. You just, oh my God, I feel something wrong in my arm. Let me go see an orthopedist. Let me go see a pain doctor. You just go see the pain doctor. But most of the time, that might not be the great choice for you. So PPO plan give you freedom. You can use it in network, out of network. HMO plan, you can only use it in network. No coverage outside of network. And this is why people have to be very careful, Tamika. For example, we here in Fort Myers, we have multiple insurance carriers that are here in Fort Myers. Certain of them don't have, they're not part of the Lee, for example, one of the biggest chain hospital in our area, Lee Memorial, they're not in the network. If they're not in network, and then you go to the hospital and have a surgery, they're not going to cover it.
Oh, wow.
Even when you have insurance. So knowing which hospital, especially the hospital that are close to you, are in your network, extremely important. So, you need to educate yourself.
So your staff will kind of walk them through to let them know and lay out, hey, this is the hospital that is in your network. If you needed to go to the emergency room, this is the
this is how much it's going to cost you. And then ER visit too. Education. Some people think if I have insurance, I can go wherever I want.
I would think that too.
That's not. What about the cost? For example, you're not feeling well. You have a headache. You go to your primary care. Probably you have no copays or $10 copay. Or you go to an emergency, they call them urgent care services. You go to this clinic, probably $50. But you said, no, let me go to the hospital because it's going to be faster.
No.
But your plan has probably $200 or $300 for an ER visit plus 30% co-insurance.
Oh, wow.
So one visit at the ER can cost you between $1,200 to $1,500.
Oh.
Depending on your plan. So if you have high deductible, then you cover that. They don't cover it for you. So you always have to make sure, even when you have the insurance, where the places you take services count. Some places cost you more than others. Educate yourself ahead of time can really be very good for your pocket.
Right.
So not only I'm going to take an ATM card, you can go wherever you want. Yeah, you can sometimes, but it might be costing you more money.
Yeah. Like I said, we're almost out of time, but I know we focus today on health insurance, but there's so many other different prongs to Best Insurance USA. There's also business insurance, which is very important. Life insurance. I'd like to invite you back on the show to discuss the importance of life insurance, because a lot of people, especially in the minority community, when we think about life insurance, no one wants to touch that. No one wants to touch having a will or a trust because no one wants to die. But guess what? 100% of us are going to die one day. So with the life insurance, it's basically covering the income that's lost.
Yes.
When that loved one passes away, say maybe if you had a 2-income family household, or maybe the wife stayed at home and the husband worked, you lose that income. So it's income replacement. And not only that, leaving a legacy for your family. So that's very important.
It is indeed. I would love to come back, Tamika, because this is a long conversation, especially for our community, for them to understand. And in life insurance, actually, right now, it's not only about life insurance. You can create wealth. Life insurance is actually asset. Do you know if you have cash life insurance with cash value on it, and you can sell it? At certain time, you're 20 years, 30 years, or 10, you can sell your life insurance. Life insurance is actually asset.
Depends
what plan do you have?
And you need to also be educated as well.
What plan? Do you have a term policy? Do you have a whole life policy? Do you have a universal life? Is it an index universal? What plan do you have?
Okay.
We'll make it different.
Okay. This is juicy. As you can see, Pauline is very passionate and she's a wealth of knowledge. So we're going to have it back. So before we wrap up, can you tell our audience how they can reach you and what's your website? It'll show on the screen.
All right. Thank you. So the first thing I'm going to tell them is open enrollment. Open enrollment start, as you all know, maybe November 1st. It ends December 15th. The tricky part is we have an extension until January 15th. A lot of people that wait at the last minute, you know what they're going to do? They're going to apply January 14th. But remember, if you don't have insurance, you do that. That's okay.
Wrong, right?
But you're going to have it in February. You're going to spend 1 month in the year without insurance in January. And if you already have it, you don't renew before December 15. Whatever changes that you made to your policy, not going to be in effect until February. So the good practice, you renew, you buy your insurance before December 15. So anything that you do can take effect in January. For us, you can go to our website. It's www.bestinsuranceUSA.net. You can call us. It's 1-800-490-0971. We have 7 locations. We're on the East Coast, the West Coast, Central Florida. If you visit our website, you're going to see everywhere we are. And for your convenience, we have a call center. You can call us, and then we'll be able to take your application over the phone if you do not want to take the work and come to the office. I would love you to come. At least we can answer all your questions so you can have the right plan for you and your family. But if you don't want to do that, that's fine. You can still call.
So you guys, you don't have any excuse. There's all sorts of ways that they can help you, whether it's on the phone, in person. How about virtual? Can do Zoom?
Yes, we do Zoom too.
Zoom, why not? Why not? So thank you so much, Pauline.
Thank you, Tamika, for having me.
You're welcome. So guys, we did something a little different today. I know we usually bring our nonprofits, volunteers, and philanthropists, but we felt it was very important to discuss the importance of health insurance, because health insurance and not having it, you can go bankrupt. But guess what? There's more layers to health insurance. There's the life insurance. If you're an entrepreneur, the importance to have business liability insurance, professional insurance, and so much more. We're going to get into those conversations in later episodes. So guys, don't forget to like and subscribe to my YouTube channel. Stay tuned for more Grow Your Nonprofit podcast episodes.